PRP, platelet rich plasma, essentially with this we're talking about platelets. So when your body naturally gets injured, cut, bruise, etc., the portion of your blood that oozes into that space and starts that inflammatory and healing response are your platelets. So what PRP essentially is we take your blood, spin it down, concentrate your platelets, and that's what we're putting back into the injured tissue. They're little growth factor bombs. They create a bunch of inflammation, a bunch of pain after the procedure, but they facilitate a healing response. And you might be asking, why are we trying to create acute inflammation? That's bad, right? We're taught acute inflammation is bad, but it's actually a necessary part of healing. When your body naturally gets injured, you need that initial acute inflammatory response to create that initial blood supply so the healing response can happen. The areas that break down your body, that typically break down, are places that have a poor blood supply. So you got to create one there. And so that's the whole goal of PRP, is to start that inflammatory response in an area that has a poor potential to heal.